Hi everybody, I'm Laurie Cadden and we are here for Program 7 of the Lackawanna County Medical Society's Public Health Education Series. We're here with Dr. Matthew Berger, who is a psychiatrist. We're in Melanie's office actually, but Dr. Berger's over on Montage Mountain Road, a great location, as we were saying, right across from the ballpark.
Yep.
Convenient. Are you a ballpark? Are you a
we go occasionally
guy?
and then we go to the concerts, so
Okay.
we don't have to, we can park here and walk up.
There you go. So you're here, we were talking about this a little bit earlier, you've been part of the Medical Society now for 19 years. You've come from upstate New York, or Hyde Park, and as I said, have to say it again, we have a little bit in common. I'm from West Side, the Hyde Park section, Hyde Park, New York. We're friends already, Doc.
Kismet,
what do you say?
kismet.
There you go. So anyway, there's, as I said, I am fascinated by anything to do with mental health. I think it is just a fascinating subject, and you guys, you get to work in it and get to see all of the changes and all of the things that are available to people now in all facets of mental health. But if you could tell us to start, can you clarify the difference between some of the mental health professionals?
Sure. It's a wide field and there are an awful lot of people who are involved in it. What I do is I'm an MD psychiatrist. So I went to medical school, then I did a little bit of an internship in regular multiple fields of medicine, peds, internal medicine, etc. And then I went on to a residency in psychiatry. So that's a 4-year program. And so what I do for the most part, though there are lots of subsets of psychiatry, is I do mostly psychopharmacology. We do the diagnostic and then we do mostly medications. Now, there are psychiatrists who do more traditional therapy. There's the Freudian, the Jungian, all that kind of stuff. Then there are therapists. Now, under therapists, it's a wide variety. There can be psychologists, which can be anything from a PhD to a master's, who do more talk therapy. And there are a wide variety of talk therapies, whether it be CBT, DBT, insight-oriented, etc. Then there are social workers who also do that. Then there are licensed therapists. There are also what we call mid-level providers, and these would be nurse practitioners. So there is a specialty in psychiatric nurse practitioner, and they do sort of a cross between the two. And then we also have physician's assistants, all of whom are involved in the mental health field. And there are actually a bunch of allied services too. There are things like art therapists, music therapists, and a variety of other therapists. So it's a broad field.
You're not kidding. Wow. So tell me, how common is mental health?
It's actually very common.
Mental illness, excuse me.
Mental illness is very,
health is a good thing, right?
It's very common. They
Yeah.
say 1 in 5 Americans at some point in their life will experience some sort of mental illness. And according to the World Health Organization, not just in the modern world or the first world, but even in the overall global area, that 2 or 3 out of the top 10 illnesses in the world are psychiatric. And if you look at, for instance, like suicide, it's the second most common cause of death between the ages of 15 and 25. After that would be traumatic events, is obviously first car accidents, etc. So it's very, very common, and it is not insulated. Is what I would say. It's an equal opportunity employer. You can be rich, you can be poor, you can black, white. It crosses all fields.
And what are some of the most common? Because when you're saying suicide, how does someone say there was no indication that someone had any form of mental health issues, and then they commit suicide? Knowing if that was the case is hard to prove, right?
Well, the thing is it's very unusual to see a suicide in a vacuum.
Okay.
Most times, the most common cause of suicide is obviously mental illness. The most common ones are things like major depression, anxiety disorders, obviously things that are more severe, things like bipolar disorder, and things like schizophrenia, more of the more severe illnesses. But probably the more common ones are major depression and the anxiety disorders, which could be things like panic disorder, obsessive compulsive disorder, obviously post-traumatic stress disorder. So there's a wide variety of illnesses.
So those are the kind of types. Let's talk a little bit about a situational type depression, because I know if someone is diagnosed with depression, that is considered a mental illness.
Absolutely,
correct?
that is, absolutely.
So what about, and I know there's different types of that type, and I think that is the most common for people to understand. They know depression is, and you're treated for it or medicated, or you see someone, you talk about it, and medication. I know that there can be someone who's situationally depressed.
Right.
What happens in a situation like that?
Well, there's a couple of different things. First of all, most patients who have the illness major depression are going to have some sort of pre-existing condition, or at least a familial history. It is definitely genetic. It definitely tends to run in families. So like, for instance, if you have one first-degree relative who is depressed, you're about 1 in 4 to have it yourself. If you have 2 first-degree relatives, mother, father, you're about 50% you're going to have major depression. But then oftentimes it's that trigger too. You might be doing okay even with a family history, and then some traumatic event occurs, death of a loved one, financial stressors, loss of a job, it can trigger the episode of depression. Now there are also people who don't have that, but who have legitimately just a situational depression, where something bad happens. Those tend to be transient, tend to be not treated with medications, more usually with therapy, though if they go on long enough, sometimes we'll use medications in them.
So how does someone then get diagnosed as having a form of mental illness? What would be the way they would do that?
Traditionally, you would go see a professional of some kind. You can even, most actually, mental illness is treated at the family practice level. You go to your family doctor and you say, I'm not feeling well, I'm having some problems with sleep and appetite, I'm getting crying spells. And traditionally the first line of defense is the family doctor or the internal medicine person, your PCP. Oftentimes they will refer it out to a psychiatrist. Sometimes they'll go to a therapist. In the case of students, a lot of times counseling centers, whether it be the guidance counselor or there are mental health professionals in the schools. So it's a wide variety of ways.
And then say something as severe as a schizophrenic type diagnosis. Does that happen gradually? Does that build, or does it just snap? Does it depend on the person?
It depends on the person, but there's definitely like what we call a prodromal phase with schizophrenia, where normally we will see some evidence of either mood disorder or some sort of downward social spiral that will occur before the full-blown break.
Okay.
But schizophrenia definitely is more genetic and does have less environmental factors.
And so if someone is diagnosed with that, I know because I have a friend whose daughter has had schizophrenia for many, many years, and there are times when she lives a completely normal life, and then other times when something triggers it and it goes a little crazy. So her whole world seems to close in on her. What is that how that traditionally works?
Well,
Can they
really
have
depends.
good stretches?
They can have very good stretches. Oftentimes it's medication compliance. One of the biggest issues is the fact that many patients who have schizophrenia will stop their meds or not want to take them. Sometimes it's an environmental factor. They're doing well, they lose their job, they lose a loved one, someone dies. Sometimes it's one of their major support systems. This woman, God forbid, you've had a support system of the patient's mother, and now the mother passes away. A lot of times that patient will not be able to cope with that, and they'll go into a schizophrenic break.
Okay, and I noticed too, you just said their meds. I have a few friends who are bipolar, and there's days when they feel like for weeks they're going great, they stop taking their medicine. Unlike another type of illness, you really can't stop.
That's
Why
true.
do people who have mental illness think they can automatically, break themselves of taking it? Because they feel good?
I think there's a lot of factors. It's not one. Number one, a lot of times they feel good. They feel like, I'm doing well. Why do I need to take this medication?
Medicine, right.
Not realizing the reason why they're feeling good is because of the medication.
Okay.
Sometimes it's stigma. They're like, I don't want to take those mental health pills. It's, they're bad for you somehow, or they, make me feel like somehow I'm lesser than. And, my feeling is listen, I take 2 antihypertensives and a Lipitor every day. If I had mental illness, I would take it the exact same way and think it's just a different organ. Unfortunately, society doesn't look at that way as much, and sometimes patients are uncomfortable with it. Sometimes it's as simple as, unfortunately, they can't afford them. Some of these meds are very expensive, and they don't always have access. And sometimes they just forget. And the difference is that with severe mental illness, like bipolar or schizophrenia, once you miss a couple of doses, you tend to spiral pretty quickly, and now you have the illness interfering with you taking the medication. There are, especially in schizophrenia, we're using a lot of longer-acting injectables, where the patient, there's one that you actually only have to take the injection once every 3 months. So it's really very convenient. Plus, it's pretty obvious. If the patient doesn't show up to get their shot, guess what? They're not taking their meds. And you can call the family or call the patient and say, hey, you missed your shot, you need to come in. And that really has been helpful for the more severe. That's not for depression or bipolar, that's for schizophrenia.
Do you think something will ever be formulated to have an injection so that people don't have to take necessarily, even just for something like bipolar? Because that would be a very interesting thing, wouldn't it?
It would. I mean,
wow.
like I said, right now the thrust of that is it's schizophrenia, but who knows?
Yeah,
Anything's
that
possible.
would be much greater. Tell everybody a few of the symptoms that someone who you may think, or a family member who might be listening, I know there's probably many, but some classic symptoms that maybe they should be getting some help.
Well, it depends
or
on the
seeing
illness.
someone. Right,
I mean,
right.
we'll start with the major one, which is obviously major depression. It's the most common illness that we have in the States. So the two key ones that we talk about initially are anhedonia, which is a big way of saying things that you normally enjoy, you no longer enjoy.
Say that word again.
Anhedonia.
Okay.
Think of hedonism, which is like fun, pleasure.
Okay, all right.
Anha, against
Okay.
hedonism.
All right.
So things that you would normally find pleasurable.
Great.
So let's say you're a big skier, or you're a big baseball fan, or a big football fan, or you like the opera or music. All of a sudden, those things just leave you cold. You're just like, I don't really enjoy them anymore. Just being sad, day in, day out for more than 2 weeks. I just don't enjoy. I'm just sad, tearful, down. Sleep changes, either sleeping too much or sleeping too little. Appetite changes, eating too much or eating too little. Irritability. Those are all big symptoms. And energia, lack of energy. I just feel like I just don't have any juice. The general malaise. And obviously thoughts of suicide are obviously in there. So those are some of the key symptoms of depression.
And if someone says that to you, someone says, not to you, but to you in general, talking about suicide, is that a major red flag, or is that
absolutely no? That
so
is
you should never take it lightly, right?
Never take that lightly. Words have power, and you don't want to ignore it. Now, there are lots of times people would say, Jesus, if this car doesn't move in front of me, I'm going to kill myself.
Exactly.
That's not it.
Right.
But in the context of, I'm really struggling, or, a lot of times we'll see with kids or family, divorces, boy, just my life is terrible. I just don't want to live anymore. Those words have meaning, and I think we should not ignore them, because unfortunately when we ignore them, then a problem can occur.
Yeah, so what, as far as when you have this, people, you're saying there's diagnosis, it's familial. Are there anyone out there who are immune from getting a mental health diagnosis?
I don't think anyone's immune, but there are people who are, immune is a tough word.
Okay.
I think there are people who are less likely. And I think for certain illnesses like schizophrenia, you're not gonna, if you don't have it by a certain age, the odds of you getting it are very, very slim.
Okay.
But for things like depression and anxiety, I don't know if immune is a stronger word, but there are people who are less likely. Yeah.
And they're what, happier people?
Just genetics.
Yeah, is it?
Just genetics.
The other doesn't play into it at all, personality traits?
Not really, because
No?
you can have somebody who has a very positive personality and the illness can still flare.
Okay. Darn. So I'm saying, yay! Yeah. Okay, so then how can it be prevented?
Well, I think obviously, when we talk about prevention, if you have an underlying, there's what's called endogenous depression. Okay. Endogenous means it just comes from inside of you. And that's what I boil down to. It's just chemistry. Mm-hmm. These are people whose lives are going well, their families are good, they have good jobs, and it just happens. And those are almost always familial, genetic, usually repetitive, happening multiple times throughout their life. And that's, you're just going to get it if you're going to get it. However, doing things to minimize your stress. I always say diabetes is the best model for this. If you're going to be diabetic, you're going to be diabetic. However, if you eat right, exercise, watch your sugar, watch your stress level, get enough sleep, you're less likely to have diabetic flares. It's the same thing with depression. If you have depression, you have it, but all of those things can help you manage it. And then obviously medication and therapy plays a huge role.
So is anyone ever really then cured, or is it managed then for the rest of their life?
Okay, you can have one episode of depression and get that treated, and that can be considered cured. But once you have more than 2 or 3 episodes, you're really just managing.
So then, as far as the treatment of those things, we've kind of touched on that. You said you can have, both from a standpoint of therapy, where it's
talk
therapy, which I happen to love. And how effective do you think that is, minus the medication?
Well, all of the studies show that both together work better than either one separately. Mm-hmm. So medicine plus therapy works better than just medicine. Medicine plus therapy works better than just therapy. Having said that, therapy works pretty well, and medicine works pretty well. So I think if you have a legitimate major depression or panic disorder, you should get both.
Okay, because I like that. I think it's important for people to understand, though, and we were talking about this, and I wanted to say it earlier, the stigma attached to mental illness is so profound.
Yeah.
Because, as you said, it's like it's another part of your body that you need to take care of, so why be ashamed of it?
Yeah, I've never understood that. It's just, your brain is just an organ.
I think it is getting a little bit better,
It is.
though,
It
isn't
has
it?
improved significantly from like when I first came to this area, or first did residency in '85, it was much more hush-hush. I think it has definitely improved. I mean, people are much more open. Celebrities are more open. You hear, people talking, even politics, businessmen, et cetera, et cetera. I think it is improving significantly. But I would like to come to the point where, we talk about mental illness is the same way you would talk about asthma, diabetes, and I always say to people, if somebody was having a seizure, you wouldn't say, like, pull yourself together,
Yeah.
man. Why are you flapping around in there? Just stop it. You should just stop. Well, people think on some level, certain people, that you can just simply, like, pull yourself up by your
Snap out
bootstraps,
of it and
snap out of
moonstruck,
it, right?
right? Yeah, that's-
It doesn't work
I
that
know.
way. It is what it is. And again, you would never tell somebody having a seizure that, get up, stop
No.
flapping.
No.
And it's the same. It's just different neurotransmitters.
Do you think that happens, though? Because I find myself, I think there's an intolerance to people who are depressed, or things that they used to do that they no longer aren't, or they're in an episode and it's situational now, and you're like, oh God, you were just fine yesterday. How it's so
It's frustrating.
It's
Yeah.
frustrating.
It's
Their
frustrating, and
intolerance, because you love them.
Right.
You don't want them
Well,
to deal with
and
it.
you don't know what to do about it.
Right.
You're helpless
'Cause you
to
can't
really
help.
do it.
Yeah.
And I think, again, people, if there's not like a broken bone, there's nothing sticking out of their leg, they're not getting a tube up their nose.
Right.
So it's like, why aren't you better? And I think we always have to take a step back and say, listen, this is just as legitimate. It's not these people want to be this way. It just is what it is.
Yeah. So if someone is in treatment now, what would you tell them? What would be something you would suggest if they've now been diagnosed and they're treating themselves, or they're getting treatment? What can you tell
Well,
them?
I mean, I think the first thing is don't make the illness what you're all about. Don't say, I'm depressed. I'm a depressive. You are a person with all your other personality traits and characteristics that happens to have the illness depression. So don't make it who you are. It's just like any other illness. You don't say, I'm an asthmatic.
Right.
You say, I'm a person who has asthma, or I'm a person who has diabetes. But sometimes people tend to, like, focus on
And label
that.
themselves that way,
Exactly.
yeah.
Which I think is really negative. The other thing is treat it like any other illness. Go to your doctor, go to your therapist, take your medicine, do all the things that we've talked about, exercise, healthy
That's what I was
eating, right,
gonna
all
say.
that stuff, and manage it like you would manage any other illness, and put it on that level. It's just like anything else.
So exercise really is
It absolutely
a powerful,
helps. Yeah, absolutely. The opioid
combatant, right?
response, endorphin release, tension mechanisms, all those things are good. I mean, I always say people with mental illness have to live the way we all should. We all should watch what we should eat. We should all exercise more. We should all watch our stress levels. We should all be socializing.
So then tell, if you would, our last question, do we do okay
We
with
did
time?
good.
We
Yeah,
did all right.
great.
So tell everybody, if you would, if they feel, or if there's someone out there who has a loved one that they think, or you're in flux, what should I do? What is the best way for someone to get help?
Well, I mean, if you're in crisis, let's kind of divide up what
Okay,
help
that's
is.
fine.
Crisis is, patient, I think, is someone who's having suicidal ideation, or they're at risk. Go to your nearest emergency room. That's, there's always a mental health worker available, a crisis worker. There's a variety of emergency rooms. There's also several helplines. There's the warm line. There's a crisis hotline. All of the counties have them. You can pick up the phone and there's a crisis line. But let's say you're not in crisis. There are a variety. A lot of times the first stop is the family doctor.
As you said, yeah.
Go there, talk to him or her. They can kind of guide you in the right direction. There are obviously a variety of mental health centers available. Every school has one. So if you're in college or in high school, or you can go to your mental health there. Obviously, there are offices all over. There's myself. There's a variety of different doctors. There's also the mental health clinics. One of the things that people are always concerned about, how do I pay for it? All the counties have counseling centers that go on sliding scales. So you can always go there for financial if you don't have the money.
Okay, great. And that's a good thing you touched on the schools. I think it's becoming much more available for the younger children and people to understand that the schools, I don't know how obvious that was years ago. Like when I was in high school, I don't remember
I don't
it.
think people were aware of it. It was a lack of awareness.
Yeah.
I mean, people always say, is there more mental illness now than there was 40 years ago? No, I don't think so. I actually think there's less, or about the same.
But more options for them.
Well, but it's more recognized.
Okay.
Before, they just sort of hid in the background, and people are like, "Oh, he's weird, or
And
he's
that's where
quiet,
the
or he's
stigma comes from,
isolated."
don't
You know,
you think?
yeah,
Trying
you
to
know,
get rid of all that
yeah.
past
So
stuff.
now I think that it's not that there's more mental illness; it's just more recognized.
Okay. Anything else you may want to tell our viewers that I didn't touch on before we close?
No, I just think that, again, I think it's really important if you feel you have issues of some sort of psychiatric problem or mental illness, get the help. It's very treatable, which is another thing. I think, 30, 40 years ago, our treatment options were limited. We have a lot better treatment options. The medications are much cleaner. They have much less side effects. Our ability to diagnose and treat these illnesses has increased exponentially in the last 15 or 20 years. So it's really worth getting treatment.
Well, good. Thank you very much for your time
Thank you.
today, Doctor. So
Thank
nice
you.
to
Nice
meet
to meet
you.
you.
Okay, everybody, this has been Dr. Matthew Berger talking a little bit, a lot of bit, I guess, about mental illness, and that was our segment 7. Segment 8 will be on macular degeneration from Northeastern Eye, and we have Dr. Pierce coming in next month to talk about that. So again, this has been sponsored in part by CHS, and we're very grateful for that. And again, it's coming to you from the Lackawanna County Medical Society's Public Health Education Series. So have a great week, and we'll see you next month.